Raynaud's disease, which is...
We had it yesterday. We had a question.
So just the change this morning, and when it's ruby red again, it still doesn't feel right. It's just trying to perfuse more adequately, but the blanching is it actually makes the small arteries in the most distal parts of the body contract, and they don't work as well. So I'm a really good example of it. I could never be with, I could have worn gloves this morning. So it'll take a while, and it's very uncomfortable. It's difficult for me to feel. And then as the arteries open back up, there's like a real burning sensation that happens. So sometimes medication can also contribute to this. You can leave this there, and thank you for reminding me. I have sheets for everybody if you want them. We're gonna need the kit. We're gonna need a pair of clean gloves, and there are gloves in here, but I want you to feel free to be able to take gloves from here until you're more accustomed to getting the gloves on and off. Central line therapy is therapy that's used to support during patients' treatment during some acute crisis. These lines are very dangerous in the sense that they're going directly into major vessels in the upper chest. It's really important that sterile technique be maintained during insertion, as well as when you're accessing them, right? This is a triple lumen, meaning 3 ports. There are small antibiotic impregnated caps that are used once you access those ports to cover them, and I'm sure you've seen those out on the units. Triple lumen usually means there's some component for dialysis. Those catheters are even larger when they're inserted, so we can also have never events with these, meaning that you can cause a central line infection, which is really almost sepsis. You're introducing, if these aren't maintained correctly, bacterial load into the patient's bloodstream, and they can actually die as a result of that. So just like with Foley's, just like with trachs, this is so important that there's a checklist that when the doctor inserts these, the nurse has to check everything off, especially that there's consent, that it's signed and dated, that the patient's been informed of the risk, benefits, and alternatives. If the patient can't communicate in that way, then the family. But that sterile technique is maintained during the insertion of this catheter. The doctor has to scrub, he has to gown and glove at the bedside, and if you at all have a sense or directly see something that the doctor's going to use become contaminated, you have to stop the procedure and the doctor has to start over again, whether that's contaminating his glove, his gown. So that's how important it is that a nurse is stationed with a checklist at the foot of the bed to make sure that sterile technique is maintained, right? Want the head of the bed elevated. Patients can have this therapy, but really ICU or step down areas is only where it's employed. Want the head of the bed elevated. As always, I'm going to introduce myself, explain the procedure to the patient, wash my hands, provide privacy, always, always, always 2 patient identifiers. And we're gonna talk about just some nuanced things. You okay? God bless you.
Thank you.
Right, we want the patient's face turned away from the site, because if they cough or even talk or sneeze, any debris or organisms from their mouth can be displaced onto the site, and we wouldn't want that to happen. So part of what I've got to educate the patient about is they also need to wear a mask. So they need to be masked, we're gonna be masked, and there is a mask in the kit, and you should have your visor on as well. That he's gonna need to wear a mask, and I'm gonna turn his head away from this. We're gonna talk a little bit about